Welcome to the Art and Science of Brief Psychotherapies video. On this video, you'll see a number of illustrations of different therapy models. Each has been shown to be effective, and each has received empirical support. However, it is also true that it has been difficult to demonstrate that one brand, one approach, surpasses all the others. One of the reasons for this is the finding that there are common factors that cut across all effective psychotherapy treatments, and that the common factors play a large role in determining that a therapy will be successful. They are essential to achieve a positive outcome. Does this mean that it is unnecessary to follow a model of therapy when engaged in treatment? No, it does not, because one of the important common factors for effective psychotherapy is that the treatment is being guided by an approach that is coherent, that makes sense, and provides a rational framework that both patients and therapists can believe in. This creates positive expectancies regarding the treatment, a sense of direction, and motivation to try new solutions to old problems. So, what are some of the other common factors that are evident in all effective approaches? Perhaps the most important and most studied is the therapeutic relationship, the bond formed between therapist and patient. This has come to be called the treatment alliance, and it exerts a powerful influence on how the treatment is likely to turn out. Crucial to the development of an alliance is the establishment of a collaborative atmosphere where mutual agreement exists between therapist and patients about the goals and tasks of psychotherapy. This type of atmosphere promotes trust and acceptance, which leads to openness in expressing thoughts and feelings. Evidence indicates that the therapist can facilitate this type of atmosphere by showing high levels of empathic understanding, warmth, and an accepting, non-judgmental attitude toward the patient. Interestingly, just as in psychotherapy, these same clinician interpersonal qualities or skills produce better outcomes for patients treated with medications. There are other change-inducing ingredients that are common across therapies. These include catharsis, where patients let go and release emotions and tensions that have been burdening them; identification, where patients learn ways to imitate and approach their problems using the framework that their therapists have taught them; and the development of feelings of mastery, as patients gain a sense of control and understanding about their problems. Another relationship finding is that patients will experience gains from therapy as a result of having what has been called a corrective emotional experience. This refers to patients perceiving therapists as treating them in a more supportive and constructive way than did significant authority figures in the patient's past. The contrast with past relationships may help patients feel secure and provide them with the strength to think and behave in new ways, even when faced with familiar conflicts. Another set of common factors that will affect outcome is based on the characteristics that the patient brings to the process. Of particular note here are the number and severity of symptoms that are being experienced, the patient's ability to relate to another person, their motivation to improve, and their ability to point to a central problem. Similarly, life circumstances, such as having available social supports, a stable family, and a reliable work situation, would all bode well for being helped, especially in a brief treatment format. Within various models of psychotherapy, it helps for patients to be educated about their role in the process, to know that the treatment will be collaborative, that it will require their openness to learn about the assumptions or expectations they hold, that some of these assumptions may turn out to be inaccurate, and that their honest feedback to the therapist about their perceptions of how things are going in therapy will be very helpful to the process. Please keep the common factors in mind as you view the various examples on this video. Watch these experienced, expert clinicians as they create collaborative, supportive relationships and move their clients to viewing and trying new ways to approach their problems, and become sensitized to these common factors issues in your own work with others.